Hello, everybody, and good morning if you are seeing us live, and we're happy to have you here. I'm Dr. Mark Lickey here at Maxwell Clinic, and next to me is Mary Scalf, physician's assistant, and also what I call my little sister.
Yeah, Dr. Lickey is not my big brother here. So thanks for having me on with you for this topic.
It's nice to just have this more as a conversation rather than just a session to throw a bunch of facts down your gullet. But we will be giving you some facts today.
Yeah. What are the goals of our conversation today about long COVID?
Well, we really want to talk about, it's like, why is this important? And what is long COVID? I mean, that's a big question.
I think it's so confusing, and I believe even among healthcare practitioners that it's probably not well defined and well picked up on.
And in a way, it is a little bit difficult to define, and we'll talk about that in a little bit. We want to talk a little bit about pathophysiology. Otherwise, what goes wrong in long COVID? Why is it affecting our bodies, and
what's driving the dysfunction?
Yeah. And then we want to end with some tips on, like, what is it that we can do to help those who are suffering with this, because it is something that is significant for a lot of people. So I feel like it's a super important and timely topic that I really couldn't ignore it, because I've got friends who've got long COVID issues. I've had more and more patients showing up here at Maxwell Clinic who have long COVID. And I was like, we have to talk about this.
Yeah. And what's really heartbreaking, though, is because there's all these other parts to COVID that became so political that I fear that these patients are being ignored, or they're not being listened to, or they just don't feel heard at the very least.
Yeah, I think that, we're 3 years into this. Things have calmed down, obviously, with people getting COVID, and the COVID that we're dealing with now is not the same COVID that we were dealing with before, because of all the mutations that have happened. Unfortunately, it's less serious, but the fallout of all this with a significant number of people is really affecting a lot of lives, and that's what we kind of want to start about talking to you a little bit. Is first of all, we haven't forgotten about you.
No.
Because everybody's kind of wanting to, let's stop talking about COVID. It's like, okay, but there are a lot of people that are still affected by this. I mean, are you seeing this in your patient population and people that you know?
Oh, yeah. Even my own husband still hasn't regained his smell. And we're trying all sorts of different things to try to regain that. And some of these things, they seem like, oh, no big deal. But do you, like, even the sense of smell, it influences our sense of taste and our experience in the world. And just to wish that you could smell dog poop even. And remember what it smelled like.
Well, yes, you guys with your 3 dogs. But yeah, I mean, you have everything from, less severe symptoms that people are having like that, which I would still consider long COVID, to people who have lost a lot. I mean, I've got 2 good friends who had very high level jobs and had to quit because they weren't able to continue to work because of how much it's affected their lives.
And then some of these symptoms, like, just seem like people just can't truly appreciate them, right? Like how just exhaustion can set in, and due to some of those the drivers will talk about, even decreasing oxygen delivery, vascular system issues, and it just becomes one of those groups of like invisible illnesses. You look fine on the outside, so surely you're fine on the inside, and that's just not how it is.
Not the case. Not the case.
So people are suffering silently from this.
There's a lot, and we'll get into numbers in a second as far as numbers of people that are affected. I want to talk just about the cost of this. So people who are affected by long COVID, they're spending, and this is like after insurance kicks in and all that kind of stuff, on average about $9,000 a year in medical costs. That's not insignificant. No. And as far as, all the other kind of down kind of the extra things that are happening as a result, which can't really be monetized in money, it's like, those are huge. It's affecting people's ability to parent, and people's ability, just for engaging in life. You can't put a dollar amount on that.
Oh, no, you can't. Showing up in life in the way you want to, there is no like price you can put on that.
Yeah.
So
they've actually done an estimate on how much this is costing the US economy. $3.7 trillion. That's a lot of money. But yeah, so this is why we're talking about it. People are profoundly affected in a lot of different ways. And we want to delve into it a little bit. So one of the things that we want to talk about is like, how common is it? And this is a hard question. And there's all sorts of numbers out there. Probably on the low side is probably about 1 in 13 adults. I mean, that's significant right there. That's 7.5% of the population who's had COVID, which is almost everybody. I've run into a few people who haven't had it.
Oh yeah, those are unicorns.
Yes,
basically.
Totally unicorns. Yeah. But it's like, okay, well, how do we define it? It's like, it's 1 in 13 patients or people who are having symptoms at least 3 months later. Okay. And that's significant. And that's like 65 million people worldwide. That's a lot of people. But there was a study in The Lancet, which is a British medical journal, that actually showed that 45% of patients had at least one symptom 3 months out from having COVID.
Oh, yeah. That's
a lot. That's almost half of people. 10 to 30% of non-hospitalized patients at least, and 50 to 70% of hospitalized patients. So if you were hospitalized from COVID, much higher likelihood of having long COVID.
And the range of these percentages, they're kind of hard to pinpoint and exact.
It is. Yeah, there's a lot of different studies out there trying to pinpoint like what are the actual numbers. It's hard to say,
particularly in the non-hospitalized, because we had the availability of at-home testing, and maybe people didn't seek medical care. Right. They didn't need to be in the hospital, and that there were no options to really help. Why would you go to a doctor if you know you had it and you just needed to treat symptomatically in quarantine?
Yeah. Interestingly, the population that is the highest incidence of developing long COVID.
This is shocking to me.
It was actually 36 to 50, which is interesting.
Like you would think it might be the really old or really young.
Yeah. And so actually the older population, they found that the elderly, so 80 plus, are 3 times less likely to develop long COVID than people who are in their 50s, which is odd. I don't think any of us would have predicted that.
No, there's so much. Our bodies aren't made to last forever.
Right.
And you would think that some of that machinery or mechanisms in the body may not be as equipped to handle this infection well, and as far as the other issues that it causes long term.
So not sure exactly how to explain that, but those are the statistics. Interestingly, as far as where it has hit in the US the most, in the South, actually. Kentucky, Alabama, and Tennessee are all 3 of the highest incidents of long COVID. And then oddly, South Dakota, not in the South, but anyway. And then as far as ethnicity, Hispanics more than Caucasians, more than Blacks, more than Asians. So, how to explain that? Not sure. But women are definitely affected more than men. Women, at a rate of probably about 40% higher than men.
That's almost not surprising, since women have a higher incidence of autoimmunity than males do. So
yes, and autoimmunity, we'll get into that in a little bit, but autoimmunity definitely plays into how this all comes about. As far as defining it, it's a little bit difficult, but I mean, basically it's ongoing symptoms that happen as a result of COVID that just don't resolve. And usually that it's being said that it's greater than 3 months.
So do you think, does this symptom start with your acute COVID infection, or can it occur within the 4 weeks of the onset?
Or even later? So what they found is that the neurocognitive issues, neurological and kind of brain function issues can actually start a month to even 3 months after you've had COVID. So it doesn't always happen directly afterwards. Symptoms like respiratory symptoms, like people who get shortness of breath and cough, a lot of times they'll start with the infection and then it just doesn't go away. But, some people get symptoms related to their prolonged hospitalization. And so they've got those symptoms that just keep going for months afterwards. And the thing is, as far as what symptoms are we talking about, the World Health Organization has actually found that there are like over 200 different reported symptoms that can happen as a result.
So many.
And that's why this is such a hard condition to put in a box. You can't put this one in a box.
And that's why I think it's so hard for people to get the care they need, because your symptom, what do we find with a lot of these non-specific symptoms or these myriad of symptoms is sometimes you might feel like you're written off, especially if it's more like you're dealing with fatigue, or even after they rule out maybe some other issues causing your shortness of breath, you're just you're just out of shape.
Yeah, and that's probably not the case.
Right.
All right, let's talk a little bit about who are the people who are more likely to develop long COVID. So unfortunately, we already talked about one of those. Being a female is just a risk factor for this. Having type 2 diabetes, connective tissue diseases, which Mary has had a lot of experience with, working in rheumatology in the past. Oddly, ADHD, but it's a brain kind of issue, and there's a lot of brain things that can happen as a result of COVID, long COVID. People who tend to have allergies and which is not always an autoimmune issue, but it's an immune activation kind of issue. But then about a third of patients had no pre-existing conditions that they knew of. I don't know. Is this something that you've seen, Mary? Because I've definitely seen this. Is that COVID seems to hit people where they're already a little bit weak.
Oh yeah. Oh, for sure. I saw patients that whose mental health got worse if they already were dealing with a history of depression. And it's not that they just became more depressed or they had this SSRI deficiency in their body, but their symptoms got worse, and it just wasn't because of the state of the world either. If they dealt with chronic fatigue already, or just some level of decreased energy, that got a lot worse following it.
Yeah,
I was concerned because I read reports of angioedema being caused by COVID-19, and one of my patients who had unexplained angioedema, that because of those patterns I was seeing COVID get you where you were already susceptible, making it worse, that potentially if she had gotten it, she would have a very severe reaction with that and require hospitalization and intubation. So
yeah. And one particular person that I know, their autoimmune stuff just went crazy. Already had some issues, but it wasn't really affecting them that much. And having COVID twice actually, just really activated the whole autoimmune disease issue.
Oh yeah.
So
I saw it flare rheumatoid arthritis. I saw it flare Hashimoto's symptoms and antibodies. It's for sure.
So how does this affect the body? And there's no easy answer to that, because it affects the body in a lot of different ways. What's kind of ideas about how this is adversely affecting the body? So one is kind of obvious. It's like you've got a virus that's causing damage, and that you've got the virus or viral remnants like RNA or proteins that are triggering symptoms, triggering chronic inflammation. And that's probably a lot of what we see, but not all of what we see.
I don't know that many people are aware, though, that those viral particles can hang out in your tissues and just kind of be waiting.
Yeah. And doing damage as they wait.
Exactly.
Autoimmunity, which we've talked about a little bit. You want to tell them about what molecular mimicry is?
Yeah, so one of the kind of ways this is connected to autoimmunity is that the pathogen or this viral particle from COVID is going to affect the host tissues. So it's going to be using its own self to cause some issues with the acquired immune function with B and T cells, to start wreaking havoc and causing autoantibodies to form against normal enzymes, normal processes in the body. Usually think about autoimmunity as attacking your own body.
Yeah, you don't want your immune system attacking yourself. That's not a good thing.
No. So it's like COVID is harnessing some of his powers. It's like, it's kind of, I don't know, almost intelligent in some ways.
Yeah.
Like that's what viral particles do, is they hijack the body's
Yeah.
machinery to replicate.
Yeah,
So
they are pretty smart. Another thing that it can do is affect your microbiome. Some of you are very familiar with that word, others are not. So the microbiome is basically the bacteria in our gut. How does that affect our bodies?
yeah, the bacteria in our gut, we can have good versus bad. The balance of certain bacteria actually have wonderful benefits to our health. About 70% of our immune function is comprised within our gut and our gut microbiome. We have what, trillions of
I think
bacteria
so. Yeah.
existing in our gut microbiome. So
And it just affects a lot of different things. And one of the things that, has come to light in the past few years is that our gut microbiome actually affects our brains, which you'd never think about, but it actually does. And so that could be affecting, people talk about having brain fog. I mean, that's a pretty common one that people get with long COVID. Could that be partially the microbiome?
Oh, for sure.
Yeah.
And we have to think about too, though, that like when you think about the gut microbiome, I don't want you to just think about gastrointestinal symptoms when you think about that dysregulation of the gut microbiome. So, like you said, it is connected to fatigue, it can be connected to autoimmunity. It can be connected to mental health issues as well as worsening of ADHD.
Mm-hmm. Yeah, definitely. Other things that can happen, reactivation of other viruses, things like Epstein-Barr virus, which is the virus that causes mono, but it can cause other problems when it's reactivated, like chronic fatigue and stuff.
Human herpes virus 6, Epstein-Barr is in the family of herpes viruses. So it's just interesting though. It's like, what were you told when you got mono when you were a teenager? That this will go away, virus, you'll have antibodies, you'll be fine, you won't really get it again. And we're finding that's just not truly the case, and that COVID can actually reactivate some of these viruses that we thought were dormant.
Yeah. Things having to do with the blood vessels. So clotting, which, that was talked about a bit. We found out that COVID was causing clotting problems, but sometimes those problems can continue in long COVID, and that can cause all sorts of problems. Capillary function. So capillaries are the smallest blood vessels in our body, and they supply all of our organs with nutrients and oxygen and all that kind of stuff. And if your capillaries ain't happy, nobody's happy.
No. Your organs are going to be starving for some nutrients.
And then endothelial dysfunction. So that's the lining of your blood vessels. So, the lining of your blood vessels is super important. And if that part isn't working well, that puts you at risk for things like cardiovascular disease, so otherwise heart attacks, strokes, hypertension, all that kind of stuff. And then signaling issues in the brainstem and the vagus nerve. What's the vagus nerve do for us?
Oh, it helps to regulate our autonomic nervous system.
What's the autonomic nervous system? So it's our flight or fight response. That's the sympathetic versus our parasympathetic, which is the rest and digest. So it can mess with that. And I found a lot of people have had issues with anxiety as a result of long COVID.
Oh, for sure.
Yeah,
and
it's common.
Some people develop other types of like dysautonomias, and POTS sometimes starts after a COVID infection.
So, as we've talked about a lot of these things, but, cardiovascular disease, clotting issues, cerebrovascular disease, it increased your risk, long COVID increased your risk for type 2 diabetes. If you didn't have it already, you may get it. And I'm not saying these things to make people scared, but these are the ramifications that we're dealing with. Chronic fatigue, which we mentioned. So it's a bit of a mess, and there's so many things that can happen. So we're dealing with something that has kind of ramifications that we really haven't seen that much, at least on this wide of a scale with a virus before.
Oh yeah, like you don't get you don't get this with flu viruses usually. We haven't seen it to this.
I mean,
kind of
every
stuff, like-
once in a while you'll see some of this stuff, but as far as how common it is and how widespread it is as a result of this particular virus, it's significant.
So I don't mean to oversimplify this, but when I was in PA school, though, what 3 viruses cause the common cold that you were taught, right?
Yeah.
Rhinovirus, adenovirus,
And coronavirus.
If you told me that a coronavirus would have ramifications that it did, then I would have been really shocked and like, really? Like, it causes the common cold.
Yeah.
But this is by no means the common cold.
No, this is not. It's a different animal. But as far as as we said, symptoms can be so many different things, and I think that's what I found with my patients as they've come in and you start delving into, okay, when did your symptoms start with this particular issue? And it's like, did it relate to you having COVID, as far as the timeline? And I'm just finding that more and more people, it's like there is some lingering symptom that they're dealing with.
Yeah, the question that we most often ask when we start to evaluate a patient is, when were you last well?
Mm-hmm.
And if you can pinpoint that, then like, what was going on at that time? Was there an infection? So in this case, it might be COVID. There could be other stressful situations in life, hospitalizations, that can be connected to that as well.
Mm-hmm.
But that's what's so important to think about. If you're struggling with some of these symptoms that you're not getting answers for, start to think about, well, when did this all start? And when were you last well? When did you feel best? And then what was the timeline of what happened after that?
Yeah.
So
yeah, can't ignore that. So treatment. This is what can we do about this?
Oh.
It's a bit messy because it's affecting different parts of people's health and their bodies in different ways. It's like some people, it's going to be primarily an autoimmune issue, and some people it's going to be more of a neurocognitive issue, and some people it's going to be more like the chronic fatigue issue,
cardiovascular.
Yeah, I mean, that's why, I mean, even the World Health Organization, which I found this amazing, said that a multidisciplinary approach is the way to go about treating this.
Yeah.
But it's like, what I found is that people who have been trying to get help, it's hard. Well, it's hard to get doctors and clinicians to talk to each other.
It really is.
And so, maybe they got their primary care physician who's kind of like the quarterback, but then they get referred to, pulmonologists, or they get referred to a cardiologist, or they get referred to, a physical therapist or a psychiatrist or a counselor. And it's like everybody's kind of floating on their own island, and that doesn't always work real well.
No.
I've seen people really suffering because they feel like I'm seeing all these different specialists, and yet I'm not getting better, because everybody's kind of just doing their one thing and their one specialty, and it's not working that great.
Sometimes, I don't know if this is your experience, and this is not necessarily every specialty, but it seems that you're being sent to specialists and they're just checking off their boxes and saying, well, it's not this and not that, and then there's a referral to somewhere else.
Yeah, I'm seeing that a lot, actually, specialists referring people to other specialists.
Yeah.
But it gets really messy. And there's hasn't been any like specific validated treatments. I mean, they've looked at a few different things, but nothing's really like floated to the surface. I think it's because there's so many different things that are contributing to the unhealth.
So many organ systems are affected,
right,
and there's not going to be just one overarching treatment for this because of that.
Yeah.
So I find that's going to have to set the expectation for this. Unfortunately, if you're looking for that one thing to give you all the hope to get better, we don't have that yet.
We don't. I don't think we're ever going to, because of just the pathophysiology, how this is affecting people's bodies. It has to be an individualized plan of care. It has to be, you have to have somebody who's digging deep with you if you've got this particular issue, and kind of knows the right way to look at it and is looking at all the different things.
Yeah, and we have the availability here to look at so much.
We do.
Within Maxwell Care. We talked about just the dysregulation of the gut microbiome. I don't believe you're going to have another doctor that's going to be able to do this unless they're a functional medicine or integrative clinician to actually assess your gut microbiome.
Mm-hmm. One of the things that we have here that is very unusual, we have something called a glycocheck, which actually looks at your capillary function, because your capillary function can be really compromised by COVID. We see that over and over again. And there's something we can do about that.
Oh yeah, the capillary function can be tied to that fatigue as well.
Mm-hmm.
We're willing to look into clotting factors in the blood, and we've been doing this kind of even before COVID, looking at fibrinogen or D-dimer to kind of give us an idea of that, looking for any sorts of inflammation to bring it down. I think it's been amazing. When I was having some post-COVID issues, I used IV Ozone.
Mm-hmm.
And IV Ozone is going to take blood out from your veins. I think about 15 milliliters, if I remember that correctly. It's going to put it in a super oxygenated environment, and then ran through UV light and then back into your body. And it's so beautiful to see that bright red blood after that deoxygenated dark blood, leaves your body and comes back in bright red. But it's creating this kind of super oxygenated environment, and the blood goes back in, it continues to circulate, and it gives this antiviral, antibacterial, anti-inflammatory properties. And with my own fatigue and mental health, I noticed combining this with exercise that I saw improvements in my energy and my cardiovascular activity. And then I just would have with exercise alone. And I was really blown away by it. So,
yeah. And, we have a hyperbaric oxygen here. We have a lot here at Maxwell, and this isn't just an advertisement for Maxwell, but, I think when people are looking for some place to get help with this, it's like you really need to find some place where they are looking and delving deep into what's going on, and then have the ability to actually go after those things that are found to be abnormal.
Right. And it's like, I don't think it's a failure of any primary care clinicians or whoever. Everybody is doing the best with the tools they have and what they've been trained with. And what I so enjoyed coming from a rheumatology space to here is I felt kind of almost stuck in some ways in my ability to help people when I knew there had to be more. And then so coming to the Maxwell Clinic and knowing functional medicine allowed me to have that more of which to offer and to help people. So
yeah, I feel the same way. I spent 20 years in primary care, and I felt, especially as I moved on in my career and learned more about functional medicine and this way of doing things, my hands were tied. It's like I couldn't really practice functional medicine within the traditional model. And it's been great to be able to feel like I have more to offer patients. And I guess I would say something like Long COVID is almost like the perfect type of disease process, if you will, that really needs this type of care.
Yeah.
Because otherwise it's care is fragmented, or else it's just not delving into the right areas to be able to truly help people.
Yeah.
That's the way I feel.
I agree. I'm with you on that.
So anyway, that's pretty much what we had. Anything else you wanted to add, Mary?
Oh man, no, I don't think so.
That's kind of what we wanted to cover. So let me see if we can get to, I don't know if there's any questions. I don't think there's any questions at this point, but
yeah, if anyone has any questions with the time we have remaining, please feel free. If there was something that you wanted to hear that maybe we didn't touch on.
Yeah, because this is a big topic. And if you end up having questions afterwards, maybe this is recorded, so you're going to watch this some other time. Is that we can answer questions that you have by submitting them to Maxwell Clinic, but we'd love to see you here. If you've got long COVID and you've been frustrated with other care that you've gotten, we'd be happy to delve deep into this with you. So actually we do have a couple questions. Let's see here. You want to hit that one?
So that's just actually from my patient. What I think about using LDN for long COVID. So LDN is low dose naltrexone. Naltrexone in higher doses is used for opioid and alcohol abuse disorders. In lower doses, we have seen effects to support the immune function and help with autoimmune disease. So I have not been able to use it specifically with somebody with long COVID to see kind of that outcome, because when we treat patients, you have to think of it as an N of one or a study of one. So I do think it has its potential benefits. I would need to search the literature to see if it has been looked at specifically to benefit COVID, but just because we know that it will affect immune function in a positive manner, and if the mode of action that's causing the symptoms could be immune connected, then I do think it is plausible to be a benefit.
Yeah, I did run across a little bit on low dose naltrexone, and it seems to be helping people. I think especially with the people who have more of the autoimmune issues that show up as a result of long COVID.
I see it benefit a lot of autoimmune conditions.
So let's see here. What else we got? Treatments that work for brain fog. That's a good question. One of the things that we have here at Maxwell Clinic is called neurofeedback, and neurofeedback is basically a brain retraining kind of program. And so we do an electrical brain map of your brain, and then we can train your brain to work more efficiently and more effectively. And I think that's something that I've seen really help patients with a lot of these types of issues. So
brain fog is multi-layered.
Yes.
It's a complex symptom as well. So again, you have to think about, like, neurofeedback can be beneficial, but also how are you sleeping? Are you getting restorative sleep? Is there some level of even sleep apnea at night? Is there something in your diet that's also worsening this brain fog? I've seen sugar and gluten worsen mine, and I do better without it. So
yeah, and as we said earlier about the gut microbiome, if that's messed up, that can affect the way your brain's working.
I found yeast overgrowth, and I treated that, and people's brain fog got better, and inadequate nutrient levels like magnesium. So we've seen a lot of different things work for this. So to answer your question,
I'm going to let's see here. Should we go after this one? Chronic reactivated Epstein-Barr, which we mentioned a little bit. I mean, that can be tough to treat, but it definitely can be treated. I mean, there's, as you said, the ozone therapy can be helpful in that.
You have to think about the reactivated EBV, like herpes viruses, that class. We're always gonna live with them, and there's not gonna be a complete getting rid of them.
Right.
And so what I like to say is that these types of viruses like to take an opportunity when our body is suffering from something else, and it's like, hi, I'm here still. Oh, did you want energy? Did you want to think clearly? But there's natural antivirals I have used as well to help with people. You can find that what's confusing is that the internet, of course, has all these different protocols to help. And there's potentially some guesswork people do, and then it's kind of controversial because antiviral medications are said not to be helpful for mono, but I have found them to be so in some patients.
Let's see here. Seeing more flare-ups or consistent symptoms in long COVID.
This made me think, though, something I read, though, that having really high antibodies to COVID, the infection, doesn't mean you'll have better protection from it.
Right.
You have even a higher likelihood to have some kind of reinfection. So that's kind of what some of that question makes me see. But
all right. Well, I think we're going to wrap up for now, but we appreciate you joining us and engaging in this discussion about long COVID. It's out there. It's a lot more common, I think, than any of us wanted to admit. But it's significant, and it's affecting a lot of people. And go and get some help, because it can be extremely debilitating.
Yeah, and if it's something, if you're already a patient here and you want to ask that specifically to your clinician, let's start to look into it if we haven't already. So,
Yeah. All right. Thanks, Mary.
yeah, thanks, Dr. Lickey. I enjoyed doing this with you.
All right, everyone. Have a great day.
Yeah, thanks for attending.
Bye-bye.
Bye.